Hey everyone, welcome back to the channel. Today we're diving into a serious topic that's been making headlines, the Chikungunya virus outbreak in China. Over 7,000 cases have popped up in just a few weeks and it's got the world's attention. What is this virus? How is it spreading? And what's China doing to fight it? Stick with me for the next 10 minutes as we break it all down. If you find this helpful, hit that like button and subscribe for more health updates. Let's get started. What is Chikungunya? First things first. What exactly is Chikungunya? The name comes from the Kimakonde language in Tanzania, meaning that which bends up, because of the severe joint pain it causes that can leave people doubled over. This viral disease is spread by mosquitoes, specifically the Aedes aegypti and Aedes albopictus species, the same ones that carry dengue and Zika. It's not contagious between people, but when an infected mosquito bites someone, it can pass the virus on and that person can then infect other mosquitoes if bitten again. It's a vicious cycle. Chikungunya was first identified in Tanzania in 1952 and has since spread to over 110 countries, especially in Africa, Southeast Asia, and now southern the outbreak in China. So what's happening in China right now? Since late June 2025, over 7,000 cases have been reported in Guangdong province, with the city of Foshan being the hardest hit. In fact, 95% of the cases are concentrated in Foshan's Shunde district, a manufacturing hub near Hong Kong. From July 27 to August 2nd alone, nearly 3,000 new cases were reported in Foshan. The outbreak started with an imported case likely from a traveler on July 8th, which sparked local transmission. Other cities like Guangzhou, Shenzhen, Dongguan, and Zhongshan have also reported cases, and even Hong Kong confirmed its first case on August 4th, a 12-year-old boy who visited Foshan. The good news? Most cases have been mild, with no deaths reported in China so far. Why is this happening now? You might be wondering, why is chikungunya surging in China? Well, it's a perfect storm. Guangdong's warm, humid climate is a paradise for Aedes mosquitoes, especially after recent heavy rains and flooding, which create pools of stagnant water prime mosquito breeding grounds. Climate change is also playing a role, expanding the range of these mosquitoes to new areas. Plus, China's CDC says imported cases from travelers have fueled local transmission, especially since Aedes mosquitoes are already common in the region. A genetic mutation in the virus called E18226V has also made it easier for the Asian tiger mosquito, Aedes albopictus, to spread it, increasing the risk. Symptoms to watch for. Let's talk symptoms. If you're bitten by an infected mosquito, you might start feeling sick within 3 to 7 days, sometimes up to 12. The hallmark signs are a sudden fever and intense joint pain, especially in the hands and feet. This pain can be so bad it lasts for months or even years in some cases. Other symptoms include headaches, muscle pain, nausea, fatigue, rashes, and swollen joints. While most people recover within a week, the elderly, newborns, and those with conditions like diabetes or heart disease are at higher risk for severe complications. Deaths are rare globally. There have been 90 deaths among 240,000 cases in 2025, but the joint pain can be debilitating. China's response. China isn't messing around with this outbreak. They've rolled out measures that feel straight out of the COVID-19 playbook. In Foshan, patients are hospitalized in quarantine wards with mosquito nets around their beds to prevent mosquitoes from biting them and spreading the virus further. They stay for a week or until they test negative. Residents are ordered to eliminate standing water in flower pots, bottles, or even coffee machines anywhere mosquitoes might breed. Non-compliance can lead to fines up to $1,400 or even power cuts in some areas. China's also getting creative. They're using drones to spot mosquito breeding sites, releasing elephant mosquitoes whose larvae eat the smaller virus-carrying ones, and introducing mosquito-eating fish into ponds. It's an all-out war on mosquitoes.